Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the legislature may be gone, but the big issues remain. Our all-star panel is here to analyze Pennsylvania government and politics in depth and in detail, and guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, the legislature is on a little mini break. Maybe that's the way to put it. They'll come back, I think, in mid-September with a host of issues to deal with. But guess what? They resolved what some thought were a host of problems that confronted the state. Joining me, as often is the case, is our all-star panel. Sitting over here on the right of me, is that a figurative thing? Is Fred Anton. He heads the Pennsylvania Manufacturers Association. And across from me is Gene Barr. He's a vice president of government and public affairs at the Pennsylvania Chamber. And Carolyn Scanlan, she runs the Hospital and Healthsystem Association. Hospital and Health System. We got to do something about these titles, right? Can I just say you had these big... You know what? I'm going to ask you a crazy question right off. The three of you, do you maybe represent half the workforce in the state, Gene Barr?
Yes.
Easy.
Absolutely. Collectively,
do you? Is that true?
Yes, the private workforce.
Well, yeah, well...
the businesses
the businesses.
The institutions.
Well, that's...
Hospitals employ 600,000 people, $100 billion into the economy.
And you represent the manufacturing concerns?
We represent manufacturers in all areas of the state.
And ours are large and small. We have hospitals that are members because, as Carolyn points out, in many places, they are the economic drivers in those places. So we have all kinds of sizes.
Okay, let's start with the big question. I'm going to go with Fred. We'll move around the horn here. Governor Corbett, about a month before this budget was done, people said he wasn't leading. People referred to it, lead from behind, something they've criticized the President of the United States for. Where were you? Tom, you weren't out about. But in the end, his management style for a good part of his agenda, Fred Anton, seemed to work.
I rate Tom Corbett and I rate the legislative bodies on the results. I'm much more inclined to discount how these results were arrived at. I think the results were outstanding here from a point of view, from a conservative point of view.
And from the business point of view.
And from the business point of view, the results were outstanding. Now, that doesn't mean everything got done. It far exceeded my expectations.
Oh, go ahead.
And one more thing. And I think that there's a tremendous advantage to the lack of drama that is incurred in other states.
All right. Now, boy, talk about lack of drama, Gene Barr. The comparisons with Governor Rendell, was on this show many times and was a guest host. In fact, Governor Corbett has agreed to be a guest host. Yep. Tell me about this. Governor Rendell, a press conference, not every day, almost every hour. Every hour. The style differences were amazing.
Style differences are huge, and I think you saw this. And as you pointed out, you had a number of members of the media who were already, literally 2-3 weeks ago, ready and willing to say how much of a disaster and how much of a disappointment. In reality, much got done. And I think a lot of those people had to retract because when you came down there to June 30th, you had an on-time budget, no new taxes. Compare that to the last time we had a huge deficit like this back in '91. Took the state literally 2 decades to recover from the taxes that were put on. We got legal reform. We got property tax reform in many cases.
In greater detail,
lots got done.
There
was a lot of stuff done. I agree with Fred. This was a big success.
Now, stylistic differences, I mean, you follow this. I mean, huge differences, right?
I think so. We always used to talk about Governor Rendell as the man of the major deal, and he would throw everything into those deals and try to play as many things into one big deal as he could. Governor Corbett seems to be more sequential. He has a list. He knows what he wants to get done. And as you often say, Terry, follow what the person says during their campaign, because that's what they're going to do when they get elected. And he had his list from his campaign, and that's what he worked his way down. And some of the big issues are the ones that got accomplished that both Fred and Gene have talked about.
Now that's a great point. He didn't overly complicate this, did he?
No, he didn't. I give him very high marks for the dramatic proposals for education cuts at the secondary level and the primary level, Rendell had loaded up the education budget. He really had overdone it during his 8 years in office. He had the stimulus funds on top. Also, for higher education, many people are now questioning what they're getting for a college education. There's got to be some reform of the budgets of some of those higher education institutions. So even though much of the cuts to higher education were added back in, I give Corbett a lot of credit for the strategy of proposing substantially lower funding for those institutions.
Yeah, next week we're going to have the Chancellor of the State System on. I think he'll have a different view than Fred, but we want all points of view on this program. That's what we do here. Gene Barr, let's go back to these stylistic differences. I mean, I don't want to demean Governor Rendell. We used to sort of joke, call him Gabber-in-Chief, because, you know, he had something to say about every issue. And he's obviously, look, Governor Rendell's a very bright guy. Yep. I mean, notwithstanding that, do you think that he made it too complicated, as Carolyn Scanlan pointed out, by throwing so much at the legislature, whereas Corbett was disciplined, he wasn't omnipresent?
It's one of those classic dilemmas. Do you throw out a whole bunch of things and hope that you get a bunch of them, or do you focus on a couple things, really work towards getting those? Right. And I think you see the classic differences, as Carolyn pointed out. Prosecutor versus someone who's has a different way in the public realm.
Different style.
As was pointed out, he said as a candidate, I'm not going to raise taxes. What's highly ironic is here we have a public official who was criticized because he did exactly what he said he was going to do. That is, I'm not going to raise taxes. I'm going to cut state government. He did. He actually cut the budget. Didn't freeze it. He cut it.
But I do think for Governor Rendell, he threw a lot into the pot. He got a lot.
There's no doubt about that.
And so
That's
he really was a master deal maker.
All right, we're done with a psychoanalysis of Governor Rendell and Governor Corbett. We'll go and talk about some of the specifics of the issues that were completed, and then later get into what has not been done yet following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're with our all-star panel. That's tough. All-star panel, Fred, that's a little hard to get out. All right, now look. You brought up a point at the break about the style compared to other governors. Governor of New Jersey comes to mind. Go ahead, the governor of Wisconsin comes to mind.
Governor Christie, Governor Walker, with the huge demonstrations, with confrontation. There's a great deal to be praised in someone who can get difficult issues resolved and particularly favorable to their point of view without the confrontation, without the demonstrations. And Corbett succeeded in doing that. He succeeded in doing that.
No, I agree. Look, what shocked a lot of people, Gene Barr, was pay freeze for public employees in the two big unions, as you well know, but you know, more health care, pay a little more for health care, lose some of the days that you would normally get. But, as I understand, it's 10% pay hike over 4 years.
Over 4 years.
No confrontation there, right?
Correct. There wasn't. And again,
is Fred right?
Yeah. And again, I think it comes back to a little bit of where this governor decided to focus. He focused on a $4+ billion deficit. He said, I want to get this out of the way, get this distraction behind us. Now, there are other people who say, gee, it should have been more. Sure there is. He decided on where he was going to focus. He decided on where he's going to put his energy, and he put his energy on the tax stuff, on cutting the budget, on legal reform, and he kind of, from his perspective, got some distractions out of the way.
All right. I want to go around the horn here. I'm going to start with Carolyn on the issues. There was huge debate over hospital reimbursements, but before we get into that, there is no doubt that from I think collectively, all three of you were in favor and supported the fair share reform. Carolyn, explain that in 30 seconds. I know you can do this. You've done it before.
Well, you know, the Fair Share Act is really changing a legal premise around who's liable or responsible for damages. And the way our law was crafted is that if somebody had some responsibility but didn't have any funds to pay it, others who had lesser responsibility may have paid the full amount. What we've now done is changed it so that you pay that amount that you're responsible for. Now, there are some exceptions. There's a threshold of 60%, but generally it says you pay your fair share for what you've done wrong, and not what somebody else may have done wrong.
All right, we're going to come back to you in a moment for the one area of disappointment that I think you might have with the budget, and tell me if I'm right or wrong about it. Gene Barr, give me the one thing that Governor Corbett and the legislature did that the business community was happy with.
Well, the one
I know
thing,
there are more than one, but give me
bunch.
one.
I mean, you already said the one. The other
one
one is that simply we had a $4 billion deficit and there was no tax increase.
Yeah.
That's huge. I mean, when you think about that, and again, going back to 1991 when we almost wrecked the business climate, and a large degree did, in this Commonwealth. $4.2 billion, $4+ billion, we did not do a tax increase on either residents, individuals, or businesses.
Fred?
The phase out of the capital stock and franchise. Now, the capital stock and franchise tax is a big disincentive for business to come to Pennsylvania.
You know what? Every time you all bring this up, I can just say, what is this tax?
Well, this is a tax effectively on people who put resources in Pennsylvania, people who have employees in Pennsylvania, and people who have capital in Pennsylvania. That's what it is.
And the business community generally thinks this is onerous, if I get this.
It's assets of a company, and you pay it whether you make money or not.
Yeah,
And that's the problem. That's why it's so burdensome.
Now, it's been supposed to be phased out over 10 years.
And it's continuing now, is that right?
It's been going to be phased out, and it was not a big issue because Corbett played it down low. Now, in almost every situation, or in many situations, the phase out has been interfered with. It's either been halved, or it's been reduced, or it's been postponed. This time, and it's getting down near the end, and it's getting down near the end. The other thing, Marcellus Shale.
We'll come back. Go ahead.
Okay, go ahead.
We're going to deal with the issues ahead. Marcellus Shale, what are you going to tell me? Not done?
I'm going to say, I think that the fact nothing was done yet on Marcellus.
It will get done.
Yeah, it will get done, but the fact that it isn't, that it's postponed, that's a big incentive for people to keep coming in.
All right, I'm going to get, before we're done, we're going to come back to Marcellus Shale. We're going to get an impact fee, and I don't know if you agree with me or not. You may not, some of you may not like it, but my prediction is we'll get that. All right, when we come back, I want to ask Carolyn Scanlan about one of the problems that I think the hospitals had with the budget, and then we're going to move ahead. Fred already anticipating it, Marcellus Shale, school choice, and some other matters after talking about paying for things after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back. The All-Star panel is taking a look at what the legislature did and didn't do. Carolyn Scanlan, I want to go back to you on this issue. One of the things that I think there was some disappointment in the hospital community had to do with reimbursements, and it gets complicated. Simplify it. Tell us what the concern would still be that the hospitals in the state have.
We've talked about this before on your program, which is that the hospitals, before the last fiscal year, put together a 3-year payment scheme for hospitals called Act 49. And it was based on hospitals paying a fee that then allowed some federal money to come into the state, and then a formula for how hospitals would get paid. We had hoped that and expected that that 3-year commitment would stay in place.
Okay.
The governor made cuts in that 3-year commitment. The House made further cuts. Our goal was to get the legislators to honor that commitment in the end, with hospitals paying an increased fee in order to maintain the cuts that would have occurred, that has stayed in place.
Okay.
Now, we have some further cuts on other kinds of payments that hospitals get. No one came out of this budget unscathed.
Right.
And so some broad concerns about some authorities that the Secretary of DPW has been granted over the next year in order to meet the budget target of $400 million worth of savings in the Department of Public Welfare.
So you're not happy, you're not unhappy, you're kind of caught in the middle. It worked out a little better for you in the long run than you originally thought, but you still have these concerns that you've addressed.
We do, because we worry about Medicaid recipients, people who need health care.
I get it.
You know, the debate was always around welfare reform,
right,
but Medicaid is a form of health insurance.
Right.
And health insurance is important.
Okay, I'm going to turn to you. You're on the Marcellus Shale Commission. You're the guy. You're going to issue a report on July 22nd. Most of us think you'll recommend something of an impact fee to allow that to be accomplished in the fall. What's your sense about where the commission is going to go without, you know, you're one member, I understand.
Exactly. I'm one member. I don't know where the rest of the commission is. I think there's a lot of discussion, obviously, around an impact fee. What's interesting, though, is we've made visits to other parts of the state, and even local officials are not unanimous in their view that they like an impact fee. Some of them say, hey, you know what? Companies are doing pretty good by me now. If we get an impact fee, I'm not sure what it looks like. Those dollars may not come back to Lycoming County or Greene County or some of the places where you have impacts. There's going to be discussion about this. We'll see what that looks like. But as any of us who have been on boards and commissions and these kind of things know, no matter what the commission comes up with, there's going to be some tinkering. It has to go through the legislature. There will likely be changes. So it's part of the process. That process will continue on in the fall. We'll see what it looks like.
Now, Fred, you're down in the Southeast where you've got a lot of Republican lawmakers who favor an impact fee, if not even a severance tax. How complicated is that for the Republicans in the legislature?
Well, it's very complicated because it's a difference in philosophy, and they want higher taxes. And I think the Senate, generally, the Republican-controlled Senate, was not satisfied with the budget. They felt that the budget cut too much, and if they had more revenues, they wouldn't have had to endure those cuts.
Right. So what you're saying is that well, I think we talked about this on this show before. Republicans in the legislature, particularly in the Senate, wanted to spend more of the unused surplus to eliminate some of the cuts. One of them would be obviously the hospitals, others to education.
They wanted more revenues spent in this budget to cushion some of the cuts. And of course, the state's doing better. The economy's doing better. There's estimated to be a $700 million surplus. They wanted to spend that. Corbett wouldn't agree to spend that. And if there were more revenues from the Marcellus Shale, they'd want to spend that too.
Go ahead.
There was a real question as to, you know, we throw around the term $700 million a lot. There was a real question whether or not these were one-time. Are we going to have another double-dip recession? As you look at the numbers nationwide, housing has not come back. You look at some of the other unemployment numbers, they're not all that good. And I think there's legitimate concern about spending dollars. Again, when you have the $4.2 billion, we owe billions of dollars in unemployment comp. We've got the pension problems, the M-Care of trying to spend those dollars. So I understand why there was a reluctance to do that.
Okay,
on the other hand,
go ahead.
Just so we all understand, these were very harsh cuts to people who are very poor in this state and rely on support for health care, child care, people who are disabled, who are elderly, who are kids. And this will have some significant ramifications.
Okay, another point of view, well made. All right, when we come back, final segment, sell the liquor stores, maybe school vouchers. What will happen when the legislature returns with those issues? We'll find out when we return. Following.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Welcome back. All right, looking ahead, one of the things Carolyn Scanlan and the legislature did not do is something called apology legislation. What's that about?
It's one more piece of legal reform where if a doctor, hospital, a healthcare practitioner apologizes to the patient for a mistake, we'd like that exempted as proof of a problem when they go into court. The House has passed it. It's now pending in the Senate. It would be good to see that passed in the fall.
So the point is that allows a doctor to have an honest conversation with a patient without having it thrown back. And it may be something that's not even a huge mistake, some medical error. Am I right or wrong about that?
It could just be a contraindication from something that occurred.
There you go.
But they should be able to have that conversation.
All right. Man, I'll tell you, it's been tried and tried over and over again. Thornburg tried it, Governor Thornburg, Governor Ridge tried it, sell the liquor stores. Is it going to get done, Gene Barr?
Look, it's certainly going to be one of the things that get talked about. I think it lines up behind vouchers. Our perspective from the business community is I would lump vouchers and the sale of liquor stores in the same. We think you benefit by competition. The education system needs competition, so does the state store. Now, they've done a better job. I would argue that the reason for the improvement you've seen in state stores has been the threat of competition.
Oh, okay. Yes or no? Come on, I'm putting you right on the spot. Maybe. You're going to give me a maybe, right?
I think it's going to be tough to finalize it this fall.
Fred Anton, yes or no? Sell the liquor, is it going to pass?
I don't think it's going to pass, but I think it's very important that it does, and I think there's no reason why it shouldn't. Now, 80% of the people in all polls are for privatizing the liquor store. They've got to confront the unions, but I think that if they cannot get this done, it is not a good...
Hold on a minute. It's just not the unions. You got conservative, rural, Republican lawmakers who have a problem with this because they don't want to see...
That's not the same factor as the unions. The big thing that's preventing this is the union workforce. That's my judgment.
And you don't think it gets done?
And I think it's marginal. I think it's 50-50.
Does Corbett lean heavily on this? Is this a huge item for him?
I think he picks up a couple of other things. First, as some bigger ones, he'd like to do it. It brings Pennsylvania into the 20th century, let's call it, let alone the 21st.
Only two states, right? You didn't throw that in. Does the apology legislation get done?
I think so, they've already done the Major Fair Share Act.
Right.
They may feel like they've done enough legal reform for this year, and so we may not see it until next year.
We're out of time. Go ahead. Fred,
this is important for Governor Corbett to get this done.
Fred Anton gets the last word. Thanks for watching this edition of Pennsylvania Newsmakers. And as always, stay well. I always say that, Carolyn. Stay well.